Dental Hygiene. I am going to be showing you how to use the Wicked White whitening pen today. So it looks like this, Wicked White. It's called an extender pen, and it's used mostly for after someone has had the initial in-office whitening. It's also good for the person who is like an experienced whitener who's already been whitening their teeth for a long time, or somebody who's like a teenager, doesn't really have yellowing stains. They just have, naturally white teeth and want to kind of give their teeth a little bit of a brightness to them rather than a dull color. Now this is something that you can do at home, which is kind of nice. And I'm just going to quickly show you how to use it. So I just opened it out of the box. Okay, it comes like this, right? There is a plastic casing that goes over top of it. And it looks like this. So you just kind of peel back the plastic. It does have an expiration date on it. This one is for November of next year, just so that you know. So there is a cap here. Let's pull the cap off. Oops, sorry, window. The bottom of this has a little spinny apparatus at the bottom here, and what it does is it actually just pushes the gel up into the brush. So I usually tell the patients to be very mindful of where the gel is going, because if you twist the cap at the bottom too much, it'll push out too much of the material and it's a waste. So you just keep twisting the bottom, and as you can see, the gel is actually going into this head here, and it will soon come out of the bristles. I can see it kind of in the light there coming up. Okay, so see how it's coming out there now? So how you actually put this on your own teeth, I might have twisted that just a little bit too much. I'm going to show you on my little model here. You want to actually, this whitening pen is not as strong as what we would use in the office. So in office, we would actually use a cheek retractor to pull your cheeks out of the way so that the peroxide is not touching the soft tissue. With this, it's a little bit gentler, so it's okay if it touches the tissue, but you don't want it moving around too much, because you want the peroxide to actually stay on the teeth. So if you're going to do the fifth tooth to the fifth tooth, which is typically what we do in the office, is you just paint a nice little thin layer on your teeth. You don't want it to actually be too thick. You just want to paint a nice little amount on each tooth, just kind of coating it like almost like a thin layer of nail polish. Just make sure that you have it evenly placed on your teeth. So just that little twist that I did with the pen was enough to do the entire bottom arch. So I just kind of go through and make sure that it's all exactly where I would want it to go. And then you can give it another one twist and see how far you can get across on the upper arch as well. Again, don't try to squeeze out more than what you need. This tube should last approximately, if you're doing it every day, for about a week. If you notice that your results are where you want them to be within a day, 2 days, 3 days, 5 days, then just stop using the pen, and I would put it in a cool area. Probably the fridge would be the best case scenario, just to keep it at its full strength for as long as possible. And you can touch up when you feel necessary. If you want to do it again in a few months, then that's okay too. If you think that you need something a little bit stronger, this isn't quite working for you, then you may actually require a 20-minute session in office, or you may require 2 or 3, it depends. on the person. So if you have any other questions, you can message us on Facebook or visit us in the office or email us at norfolkdentalhygiene@gmail.com. Thanks, guys.